Good afternoon, and thank you for joining us today as we give you the updates regarding the COVID-19 pandemic here in Erie County. Today we have 23 new positive cases of COVID-19, and sadly, we have one additional death to report in Erie County, which takes us to a total of 463 total deaths since the beginning of the pandemic. Since last Wednesday, we've had 264 additional cases and the one new death. As of this morning, there was 23 total hospitalizations from COVID-19, with 4 of those patients on ventilators in our area hospitals. These numbers are not as encouraging as we would hope, especially now that all adults 16 and older are eligible to get vaccinated. So please do your part and help us to recover and rebuild Erie County. Please make an appointment to get your vaccine as soon as possible, or go to the one of the many clinics or pharmacies that now allow walk-ins to come and get vaccinated. As with anything new, I understand that some people are hesitant to get the vaccine. In periods of uncertainty, like a pandemic, people are actively seeking information. The Director General of the World Health Organization says, "We're not fighting just an epidemic, we're fighting an infodemic. Fake news spreads fast and more easily than the virus and is just as dangerous. So be careful not to follow misinformation or even disinformation when it comes to making your personal decision about getting vaccinated. When reading or sharing information, ask yourself if you're looking at the original account, article, or piece of content. Who created the article or the account, or captured the original piece of content? When was it circulated? Again, be sure to always rely on credible sources, such as the Centers for Disease Control, the Pennsylvania Department of Health, the World Health Organizations, quality organizations such as Johns Hopkins, or your own personal physician. And with that, I'd now like to turn it over to one of our experts in this community, Melissa Lyon, the Director of the Erie County Department of Health. Melissa?
Thank you, County Executive. It's always a pleasure to join you on these Wednesdays. The Erie County Department of Health is pleased to report that the status of the Erie County's community-wide vaccination efforts are continuing to improve. The latest numbers as of today in Erie County are 21,330 persons are partially vaccinated. 9,168 persons are fully vaccinated with at least one dose of vaccine. That would indicate approximately 44% of our population in Erie County has received one COVID-19 vaccination, at least one. So I know everyone wants to talk about the FDA approval for the 12 to 15-year-olds, and we are still waiting for the CDC to make their recommendation. So the Pennsylvania Department of Health is still waiting for the CDC to make their recommendation, and therefore we are doing the same. We will respond accordingly and are awaiting what the CDC has decided, though we anticipate that will be coming very soon. We rely on community members to protect each other in our county as a whole, and we are asking everyone get vaccinated to prevent the spread of COVID-19 from individuals into each other. One thing that you can do is you can visit the vaccines.gov website to search by brand to identify who is offering the brand of vaccine of your choice. This is a very helpful tool for identifying who is offering the single dose of Johnson & Johnson or Janssen vaccine. We know that there are a number of people that have been asking for just one shot, and Johnson & Johnson is the only vaccine that's offering that. So if you go to vaccines.gov, you should be able to identify who's offering that. Nevertheless, we caution everyone that this still is a time that we need to not let our guard down. The governor's orders are still in effect until May 31st. That means that the state's mask order has not been lifted, and it will not be lifted until we achieve 70% vaccination rate among all eligible adults. So universal masking is still going to be necessary to keep our cases manageable as we wait for more people to get vaccinated. In addition, the health department wanted to report some additional findings. There is a rise of cases among children. Positive cases from 19 years and below has been increasing in the past month. So we want to prevent the disease from spreading to our youth. And the trends right now look as if cases are upward from 0 to 19, a 4% increase in the past 4 weeks, but it was actually a 13.9 or almost 14% increase over the last 6 months. So we're really excited to hear that the FDA has approved emergency use authorization for 12 and older. In addition, the county has been notified through random routine sampling of our samples that are COVID-19 positive that the P1 variant is in the community and it's likely on the run. This concerns public health leaders because different variants of COVID-19 can cause more severe symptoms. They can spread more easily between individuals. Sometimes they require different treatments or treatments don't work as effectively. And this could also change the effectiveness of the current vaccines that are available. So how effective are vaccines at protecting against the variants? In short, the variants complicate our response to COVID-19. We end up using a lot more resources, time, and effort to combat variants. So we ask that the community do their diligence and really take time to make a decision to get vaccinated. So until that time, we encourage the entire community to continue to use the methods that we know that keep us safe from COVID-19. Getting tested is still very important because even if you do not have symptoms or only mild symptoms, you can still pass the virus on to others that are less healthy or more likely to be sick with COVID-19. And if you do test positive, it's very important that you isolate for the minimum of 10 days with no fever without using fever reducing medication. So the isolation period is 10 days or until you no longer, minimum of 10 days or until you no longer have fever without using fever reducing medication. Very important because we need to prevent the transmission of disease. And then quarantining is also still very important if you've been in contact with someone who has tested positive and has not been vaccinated. And it's important to follow the directions of anyone from the health department that may call you and discuss with you your isolation or quarantine. To conclude, vaccines are now more accessible, so you're encouraged to consider getting a vaccine as soon as possible. But COVID still exists in our community. Let's not let our guard down. Let's work together as a community and we'll get through this. So for now, keep working hard, wear your mask when you're in crowded areas and with others that are not in your household, continue practicing good hygiene and continue to keep our distance when we can. Thank you, County Executive. I hand it back to you.
Thank you, Director Lyon. And I want to remind everyone that this is Mental Health Awareness Month. And throughout this pandemic, we've been talking about the stress that this pandemic has put on every one of us. And if anyone watching or listening right now needs assistance, or you know of a loved one who needs assistance, there is help for you. Do not wait. You can go to eriecountypa.gov for a list of the multiple resources available for you or your loved one. I'd also like to remind everyone that enrollment opened today for the FCC's Emergency Broadband Benefit Program. Now, this program allows eligible households to receive up to $50 a month off their broadband service bill, as well as a $100 one-time voucher toward or discount toward a computer or a tablet. So for more information on this really important program, go to GET, that's G-E-T, getemergencybroadband.org, getemergencybroadband.org. And with that, we're now going to turn it over to the media for questions, and we're going to start today with Erie Times New. David, are you with us?
Yes, good afternoon. How are you?
Good, David.
Yes, this is AJ Rouse at Erie Times News. My question is,
You're very
how significant of a...
You're unclear in your...
Oh, can you hear me now?
Still a little bit unclear, but go ahead.
I was wondering how significant of a step will it be to, once 12 to 15-year-olds will, start getting vaccinated. Should the public expect to see a major impact in the daily number of COVID cases in the county once that step begins?
I'm going to ask Director Lyon if she can answer that. Did you hear that question?
I believe I heard the question, County Executive. It was regarding 12 and older being eligible for vaccine, and will that have a significant impact on cases? Any expansion of COVID-19 vaccine to populations that are in the youth categories is going to be significant, especially for returning to school and in-person learning. I think school districts would be very excited to have more students vaccinated for that purpose. It should also decrease spread within families, in particular, those that we would consider to be more likely to be asymptomatic. We know that children tend to have milder symptoms or no symptoms at all in many cases. So this should have an impact. Parents will still have to consent for students to be eligible for that vaccine or take the vaccine. And we are highly encouraging parents to get all the information they need when that becomes an option, and also consider consulting with your pediatrician or primary care provider if you have questions or are still unsure. Thank you.
Thank you. And we'll go.
All right, thank you.
We'll go to Talk Erie. Joel?
Yes, thank you, County Executive. I want you to kind of expand on what you mean by misinformation and fake news. And isn't it fair to criticize the constantly changing guidance of the CDC and the Pennsylvania Department of Health, including requiring masks on children at summer camp, both indoors and outdoors? Some of these requirements don't make sense to just normal thinking people.
Joel, there has been a lot of changing information over these many months, and it's been very frustrating for everyone, including those of us trying to get the right information out to the public. And so I agree with you that that can be frustrating at best, and sometimes can be very, very confusing at worst. But when we talk about misinformation and disinformation, there's some pretty absurd things out there on the internet about the vaccine and what it might do to you, including that they somehow can track you once you have a vaccine. That's one of the really far out there things that sometimes you see in sources, and those are the kind of things that people need to really think about. What is the source of that information? Where's it coming from? And some of that stuff just gets perpetuated over and over again as people continue to share it, and none of that is true. And so I just want people to think about the vaccine, to think about the number of people who have gotten the vaccine, who are doing fine, who feel much more confident, are much safer, versus those who are afraid to get the vaccine because of maybe some of these more absurd things that are out there, whether it's on the internet or being passed around from friend to friend. So those are the kind of things I mean when I say look at your source of information, make sure it's credible. And yes, a lot of the information is changing, but when it comes to the vaccine, there's a lot of great information out there, and there's resources that can guide you. You have to make your own personal choice. Each person does, and there could be very valid reasons why someone does not get the vaccine, does not want to get the vaccine. But again, millions of us have gotten it, and we are healthy and fine and glad we got it, and that's what we're hoping to encourage other people to do.
Thank you.
Was it Erie News Now? I'm not sure who asked the first question. I said Erie Times News, so I'm going to go with that because that was not David. I don't know if it was somebody else from the Erie Times News.
It was. I'm on here, though, if I'm able to ask a question. Now it's Ethan from Erie News Now.
Oh, Erie News. That's great, Ethan. Thank you. Okay.
Hi. Question for Director Lyon. As we go toward eventually being able to vaccinate younger people, provided that the state issues some guidance, what can the county do to encourage parents to get their kids vaccinated? What sorts of steps is the county considering in terms of a public messaging standpoint to encourage vaccination?
Thanks for the question, Ethan. As far as specifically targeting messaging around vaccine safety, I think is definitely an area that we're going to pursue. What's really happening right now, I like your question, but what's really happening is we're needing to determine where we should focus our efforts. So we'll watch and see what the data is that says how many children 12 to 15 actually end up receiving the vaccine, then we begin to determine, do we need to change our messaging to make that more effective, more efficient, increase our numbers, or have we already done a good job from national, state, and local messaging that already has parents already made a decision if they are or are not going to get their child vaccinated. So some of that is really determining what's happening and then why are they not pursuing vaccination. And so we don't just start having messages that we make up. We do a bit of research and determine what is the reason that people are choosing not to vaccinate their children. And then we try to find the information that helps encourage them to process more information, different information, and then help them get that decision. The best piece of advice I can give them is going to their trusted pediatrician or their PCP, our primary care provider. I think that all families have, many families have access to a trusted source there, and I would encourage them to start there if they have any questions at all. They're a really great resource, and they as well will be having availability to have vaccine in the near future to help parents make those decisions. So thanks for the question, Ethan.
A quick follow-up there. Are vaccines, is that our best bet to have mostly normal school year come this fall? Is that the biggest piece of that puzzle?
I know that the education system really does best when it has in-person learning. I think the pandemic has clearly demonstrated that in-person learning has such great value beyond just learning your subject matter, but it also has social components and athletic and exercise and mental health. We understand that the school systems and education is such a fundamental cornerstone in our society. So important for them to want to get back into person learning. And so I think that will be the greatest benefit. I think the other benefit is that we will then have less populations that will remain at risk for COVID-19 infections. The goal is to get everyone at a lower risk of infection. And as we roll vaccine out, phasing into age groups, we'll see more of that. Thank you.
Thank you, Ethan. We'll go to Jet TV.
Hi, County Executive. This is Brian Wilk. I know you talk a lot about vaccine hesitancy and how important it is for people to get the shot, but you're also reminding people to, in the meantime, until the rates go up, people still need to mask up, continue masking up, and continue practicing social distancing, right?
That is right, especially when you're in any kind of a situation, of course, with a group of people, and you don't know if they are vaccinated or not. But the state is still saying till March 31st, we need to do the mitigation efforts of social distancing by 6 feet, wear our mask when inside and with other people that are not living in our own home. So those things still need to happen. And then the lifting of the capacity mitigation efforts will happen after May 31st. And then you'll be able to go into crowds, but you're still going to have to wear your mask. So the mask, we know, is really important. It's an essential piece of stopping the spread of this virus. So until we get 70% of the people in the Commonwealth vaccinated, masks will still be required.
Thank you.
Mm-hmm. We'll go back to Erie Times News.
Yes, I wanted to get Director Lyon's thoughts about the recent uptick in the county's hospitalizations. Is there anything to glean from that?
Thanks for the question. So I'm not a clinician and I don't want to misrepresent any information from the hospital, but from a public health perspective, the hospitalization rates have been fairly steady over the past couple of months. When we see what we call an uptick of a few here or there, it's not terribly alarming, but I can tell you that the hospitalization rates, by talking with some of my fellow colleagues within the hospital systems, are higher than we would like to see at this stage of the pandemic. So in reality, they would like to see their hospitalization rates lower, as well as the number that are on ventilators. But overall, they're able to give really great care. And we talked about this, I think, last week, is the number of deaths. We had gone quite a few, almost 2 full weeks without reporting a death. And that demonstrates the level of care they're able to provide patients, what they've learned throughout the pandemic that works well for those patients. So that would be my answer there. But your hospital leadership is in a better position to answer how they indicate that for their ability to care for them. Thank you.
Thank you.
Thank you. And I will give a teaser for next week. We're going to bring our hospital partners back on, and they can speak to these things in much greater detail than we can, and also on their vaccination plans, because each one of them does do vaccination efforts throughout the community also. And we'll go back to Joel at Talk Erie.
Thank you, County Executive. I'd like to go back to Melissa. And Melissa, can you evaluate the effectiveness of some of the new tactics of getting the vaccine out in the community today? There was a vaccination event at the Erie Public Schools. Any initial reaction to how that's going?
Yeah, I'd like to commend our partners for their willingness and ability to sort of pivot away from the large clinics that we clearly began to see are not, that's not drawing the number of people we'd like to see, hundreds and hundreds. So knowing that we had to pivot to do smaller type of clinic availability out in the community, and knowing that school children 16 and older were eligible, seeing that in the school districts. And I think many of them have offered it up to family and community members as well. It's phenomenal. I know it's a lot of work. I know it's a lot of work to pivot and go set up at a different location every time, as opposed to going to the same location over and over again. But the partners have been phenomenal in embracing that and doing it. And in reality, we all knew we'd have to get there at some point. I think it happened sooner in the pandemic or the vaccination campaign than we thought. I thought maybe a few more months we'd still be running large clinics, but it's turned out that's not the case. So we're all pivoting and moving towards pushing out into the community is what I would call it. So you're going to see more of that. And we're all happy to do it. What it's going to do is take more resources and more logistical planning, but we're all ready to do it.
Quick follow-up, Melissa. Would you have any reports of that any of the hospitalizations that have been recent or are current represent anyone who has been vaccinated but got sick with COVID and hospitalized, or do we not have that data?
We were just talking about that today, Joel, and I know we put a request out for that. I did not see an answer that came back into us, but I will hand it over to the county executive because I know that was coming out of her office.
Yes, thank you, Joel, because that is something I'm very curious about also. And we only heard back from one facility, and they said they've had less than 5 individuals who've been hospitalized, who've been vaccinated. The vast majority of people hospitalized have not been vaccinated, and we haven't heard from the other facilities.
So 5 people got the vaccine, but
it was under 5. It was less than 5. So they didn't give me an exact number, but less than 5.
Thanks so much.
Mm-hmm, sure. Erie News Now. We're going to go back to Ethan.
Hi, another question for Director Lyon. As we look at some fairs and festivals deciding to return this summer, we see 8 Great Tuesdays, for example, coming back today, announcing it'll be coming back. Any concern from a public health perspective, or do you feel pretty safe with large outdoor events?
Yeah, that's a really great question, Ethan. I am excited for the community that these events are going to be able to take place. I know for far too long, not having the ability to get together and do the things that we love to do in Erie County has been difficult. So for one, I'm excited for the community. I'm excited that there will be these options. Do I have concern? I think as we continue to watch vaccination rates increase on a daily basis, more and more confidence comes along with more and more vaccinations. So that's also a good thing. May we see some outbreaks or what we would call clusters? It's a possibility. It's a potential. I don't anticipate having big spikes of cases. If that were to happen, I would say that we'd be likely to deal with some sort of variant that we weren't prepared for. So we'll see cases continue, but at this point, I think we're in a good place to manage what those cases look like. how we communicate with the individuals. If they comply with isolation and quarantine, we're in a good place. This would be my pitch, is to, everyone that wants to really get out and enjoy the activities that are being planned. Now's your opportunity to get a vaccine. It's never too late. Today's your day. There are walk-ins all around the county, and I encourage you to do that. Thank you.
Thanks.
And now we'll go to Brian at Jet TV.
Sure. Thank you. You mentioned at the beginning that you're not as encouraged as you would like the amount of people getting the vaccine, especially since people 16 and over can get it. In hindsight, is there anything you wish you had done differently, or conveyed maybe a different message to people so more of them could get that vaccine?
I don't know what different message we could have put out there. We had a huge supply problem in the beginning, so we had a huge demand and just not enough supply to reach that demand. And we had no control of that, of course, here in Erie County. Now we have the opposite. We have plenty of supply of vaccine, but the demand, it almost was within days, it seemed like that there was a switch from a supply issue to a demand issue. And the J&J temporary stop may have put some more caution in people's thoughts and minds that might have wanted to go. And I know there was a lot of people also wanting the J&J, and there's still a lot of people out there who want that one shot and be done. And so that's why, we said it's important for people to know that the J&J is available at numerous pharmacies throughout Erie County. And you can go on the website that Melissa Lyon had told us in the beginning. It is not coming to me right this minute, but that website, people can go on and find out what type of vaccine is available at these different locations, and then they can go and get whatever vaccine they would like. But that's the only thing I could think that really kind of, many of us think, put a bit of a halt on the demand side. And now I think it's really about convenience. People want to get a vaccine close to where they live, where they work, maybe where they do activities. And I'm going to ask Director Lyon again to put that website out there, please.
Yeah, it was vaccines.gov, easy website to navigate. I was just on it earlier today. You can select up in the left-hand side of that website which product you want. You can select all three of them. If you want Moderna, if you don't care which one it is that you get, you can select all three. Or if you're really just searching for J&J or the Janssen, you can click on that one and it'll search it for you based on your zip code. And you can even narrow it down to how many miles you want them to search within. So in increments, I think of 5, 10, 15, 20, 25. So yeah, it's a very convenient website. I recommend it.
I hope that answers your question, Brian.
It is.
Thank you.
Thank you.
We'll go back for one final question from Erie Times News. AJ?
Yes. Are there any plans to continue with large-scale vaccination clinics after the clinic at the Bayfront Convention Center, once that comes to an end at the end of the month? What are the plans are there any plans to replace that clinic?
There are so many other opportunities for people to get the vaccine now, and we're not seeing a high demand for that type of a large clinic. As Director Lyon had mentioned, we thought we would be doing those for a longer period of time, but it looks like it's really needing to become more targeted in terms of the actual location. So now that many pharmacies throughout the region have ability to vaccinate, our partners have been going out and doing more targeted, whether it be at one of our schools for the high school students, faculty, and family members, or whether it be going directly to some organization to vaccinate. Those are what we expect will be more the norm than the large clinics going forward. But if there's a need at any point, we can always pivot to what that need is at that moment. But it does take some days. You can't pivot overnight, and so that's why there's a bit of a lapse as we pivot from large clinics to a more targeted vaccination site.
Yeah, thank you.
Mm-hmm. Talk Erie. Joel, do you have a last question?
Yeah, just one last one for you, Kathy. The governor's changing to 50 and 75% occupancy starting on Monday, 100% on Memorial Day. again, talking about confusion, do you think all these changes are confusing the residents and especially the organizations who are trying to plan around these restrictions but still manage to have a summer and fall here?
Well, actually, I think that the confusion is lessening because the governor's actually given us dates when this is going to happen. And so now they can plan and gave a bit of a runway so that each business, each event location can plan for whatever is on their calendar or potentially on their calendar. So that, I think, is actually a good thing. In the past, sometimes, especially when you were taking away instead of giving more, in the early days when we had to cut back, that was very, very difficult for businesses and event locations. But I think all are happy about this, and now they can plan accordingly now that they know that the date is the 1st of June when they can go back to 100% capacity. And in the meantime, I'm sure they were happy to see even some lifting of those capacity levels for starting next week so that they can open up a bit more. You know, whether we're talking our baseball team who started back in play here in Erie just yesterday, or whether we're talking about a restaurant who's really struggled to survive under a 25% or 50% limit. They're all, I think, pretty happy at this moment.
Thanks again.
Erie News Now. Ethan, do you have a last question?
One final question for Director Lyon. We saw last year as summer rolled around, more people outside, warmer temperatures, that we saw case counts drop rather considerably. Any reason to believe that that would happen again this year, or do more transmissible variants kind of flip the script on that?
Yeah, great question, Ethan. I would like to think that the outdoor availability to us and people being outdoors is actually going to cause cases to go down, but we also have a more open economy. So I'm thinking that because it's more open, moving into the 100% capacity, more events happening, we may not see that significant of a decrease for quite some time. I think the vaccine is really the next leg of this pandemic that we need to get into the community before we begin to see a change. Honestly, I'd like to see numbers in the single digits on a daily basis for a couple of weeks, and then that's where I'll begin to celebrate. So right now we still have some work ahead of us. To answer around the variants, yeah, that's always concerning as a public health practitioner. We worry that a variant could get established in the community that could be more easily transmissible. So for example, we say 15 minutes of contact with someone else. We may have variants that are significantly less than that. It may be transmissible within just a few minutes. You may also have variants that show up where the vaccines aren't as effective, or as I had said earlier, treatments if you're ill in the hospitals may not be as effective. So there's always concern for variants making some foothold and establishing themselves in the community. So I hope Erie County doesn't end up being one of those. Thank you.
Thanks. Thank you, Ethan. And we're going to finally to Brian at Jet TV.
I have no further questions. Thank you.
All right. Well, I want to thank our media for being with us today. And as we end up here, let's go to our star business of the week, and it's the Sloppy Duck Saloon on the Bayfront Parkway. And they're doing a great job with separate entrance and exit, plexiglass located at the bar, social distancing signs posted, mask wearing enforced, and they've built little tiki houses for separate parties outside. So if you want to have a little bit more separation, you can do that. I want to thank them and all of our businesses, again, been doing an incredible job to partner with us over these many, many months. And I also want to thank the Department of Health environmental team who has been that partner for those businesses over these many, many months. It really has been a true collaboration. Neither one could have done it without the others, so thank you to all involved. And finally, as we said, with Governor Wolf lifting some restrictions, the current guidelines are still in place, though, till May 31st. And even then, face masks will be required when you are indoors. So please continue to wear your mask, keep that 6-foot distance from others, stay home. When you are feeling ill, make sure it's not COVID before you think it's just the seasonal allergies. Always wash your hands frequently and get vaccinated if you are not at this point. I hope you all have a safe week and look forward to seeing you again next Wednesday. Thank you.